Younger children tend to be resilient, but that doesn't mean that they are unaffected by something as serious and disruptive as the pandemic and its consequences. Hello, my name is Martin Alderton. I'm from Clarity Stress and Trauma. The COVID-19 pandemic is causing all sorts of psychological reactions, whether you are self-isolating, working from home, crammed in with children who'd normally be at school, whatever your circumstances. We think this advice and information could be relevant to you. This is one of a series of short videos intended to help you understand and manage psychological reactions to the pandemic. And in this video, I'm going to make a couple of simple points about something very important for millions of families: the effects of the pandemic on younger children. We can't possibly cover everything in a short video. I plan to just provide a little guidance on talking about the pandemic with younger school-aged children. The good news is that there are other expert sources of information available, which give great tips on homeschooling and other relevant issues. Some will be included in the links wherever you find this video posted. Now, you're probably the world expert on your children, but that doesn't mean you can read their minds. And anyway, you know what? They're growing up, which means they keep changing. It's stating the obvious, but things are weird for younger children at the moment. Weird and confusing. Their schools are closed, yet they're supposed to be doing regular schoolwork at home. They aren't supposed to leave their home and meet up with their friends or relatives, even outside school hours. Some children have easy access to a garden or other play area, but many don't. This would be bad enough if we knew how long it was going to last, but we don't. And the reason for all this weirdness is a disease with a strange name that is making people sick all over the world. And some of them are dying. People of all ages, but especially older people. Perhaps people like your children's grandparents. What are younger children making of it all? Don't be surprised to see aspects of the pandemic somehow arise in your younger children's play or artwork. Adults generally express themselves verbally, in what we say. Younger children can't do that so easily, so they use play and art. That's not freaky, it's normal. If your children seem to be getting along well, that's fine, there's no need to interfere. But many are not at all settled. They know this isn't normal. Remember, children learn from watching the behaviour of adults, especially their caregivers such as parents and teachers. The more calm and collected their caregivers are, the more calm and collected the children are likely to be. Of course, however calm you are, you can't just make everything better for them. But there might be some easy wins you could quickly put right if you just knew what they were. If they're asking you questions, good, that gives you a chance to check their understanding and give them information in a way that you know is right for them. But if they aren't asking questions, but you're concerned about what they're thinking, ask them. Who knows what scary ideas they might have picked up or imagined for themselves? Of course, it could be that you're the one that's scared of the conversation, because it's horrible knowing that you can't truthfully promise children that everything will be all right. And you don't know how long it's going to go on, or when they can visit their friends again, or go back to school. Not being able to answer these questions with certainty leaves you feeling helpless. What parent wants to be helpless in front of their children when they need reassurance? So maybe you've avoided the conversation. But whatever the age of your children, they do need some reassurance from their parents and caregivers. So now's as good a time as any to maybe help make the situation feel a little less strange for them by starting a conversation about the pandemic. How are you going to do that? For the very young, this can be no more than just a few encouraging words and letting them see that you are calm and in control. But for school-age children, this might be a more in-depth conversation. You could just start with an open question, like, can you explain why you and your class didn't go to school this week? Or, do you understand why they've closed the swimming pool and the play area? During conversations with younger children about difficult subjects, we recommend following 3 golden rules. Number 1, be truthful. Now, this doesn't mean being blunt or callous, but if you were to try to sugarcoat everything to try and prevent any distress at all, you risk causing more confusion when what you say contradicts what they hear elsewhere. Because they'll overhear the TV news or hear from friends or others. Of course, you should put the truth in context to help it seem less strange. When explaining COVID-19, you might say, there are lots of illnesses we have to cope with, don't we? This just happens to be a new one. You could use examples of illnesses that your child or people known to her have had. Number 2, be brief. Yes, keep it short. Younger children may ask a question that has a complicated answer, but you need to give a brief answer so they don't lose concentration. Then they will often go away to think about your answer before maybe coming back another time with another question. Thirdly, use words that you know they will understand. Almost any answer to a question about the pandemic will need careful translation for a younger child, not because you're avoiding telling the truth, but because of the odd words and ideas that are part of the truth. A couple of final tips before I finish. A bit of preparation is a good idea, of course. Equip yourself with some simple but truthful information about the pandemic so you can respond to questions. It's not difficult to find from the NHS, the BBC and other trustworthy sources. Look at the links that come with this video. There's a couple of very good sources there. And you might need to work out in advance what words you can use that are truthful, brief, but understandable to your child. If children have control over something, it helps them feel less helpless or frightened. One good example would be simply knowing how to wash their hands properly. And keep it casual. We suggest that you don't turn these into unnecessarily formal conversations. That might just make it scary for younger children. Now remember, I'm not a virologist, a doctor or a public health official. There is essential advice and information to help you protect your health and that of your children. It's easily available from expert sources. We strongly recommend you visit those sources. Some links will accompany this video. I really hope you found something helpful or reassuring in this video. Thank you for watching.